get one. Hi, my name is Alina Guzman, a sophomore at Texas A&M University. Did you know that the name COVID-19 is an acronym? COVID-19 is the abbreviation for the disease novel coronavirus SARS-CoV-2. SARS-CoV-2 is an abbreviation for severe acute respiratory syndrome coronavirus 2. The SARS-CoV-2 was named after its cousin of the 2002 SARS-CoV outbreak. The World Health Organization named the virus COVID-19 as CO stands for corona, V stands for virus, D for disease, and 19 for the year it was discovered. We have all been living with coronavirus for a year now, and we all want to get back to normal. We have all been anxiously awaiting the moment to try to get back to some sort of normality, and we finally do. Vaccines. Now that we have vaccines, it's important that we get as many people vaccinated so we can regain control in the fight against this virus. Like I previously said, I was a sophomore, an engineering student who has always had a passion and interest in medicine. I have taken multiple upper-level science courses in both middle and high school and college, and even won an award in my research of using different plants for killing non-pathogenic E. coli. I have spent multiple weeks researching to give you the most accurate, up-to-date information, and have used multiple credited resources, including the CDC, Mayo Clinic, and Johns Hopkins, just to name a few. For the U.S. to safely reach herd immunity, approximately 50 to 80% of the population would have to be vaccinated to achieve some sort of herd immunity. Today, I will give you a brief summary of the COVID-19 development, explain to you how new technology using the mRNA is used in vaccines, and then I will break down the 3 different vaccines available in the United States. Let's start at the very beginning of where this chaos began, 2020. COVID-19 was first reported on December 31st, 2019 in a city in the Hubei province of China, Wuhan. COVID-19 was declared a worldwide pandemic in March 2020 by the World Health Organization. Symptoms of COVID-19 typically appear 2 to 14 days after exposure. Symptoms after exposure include common flu-like symptoms such as headache, fever, and as well as COVID-specific symptoms, including loss of taste and smell. These symptoms normally do not require immediate medical attention, but once a person has trouble breathing, persistent pressure in the chest, confusion, and discoloration, they should seek medical attention. 80% of people that get COVID-19 will experience mild symptoms and recover. WebMD reports 1 in 6 people who contract COVID will experience more severe symptoms that require medical attention. Now, transmission. The CDC reports that COVID-19 spreads easily when people are within 6 feet of each other. Infection primarily occurs when there is exposure to COVID-19 respiratory droplets. Smaller droplets are formed when particles dry quickly in the airstream. As time passes, the amount of infection viruses in the droplets are decreased. COVID-19 can spread through airborne transmission, meaning that the virus can infect by droplets and particles that linger in the air from minutes to hours. It can even infect those that are further than 6 feet away. When the COVID vaccine was first announced, we were all excited as Pfizer and Moderna made history by developing a new vaccine using state-of-the-art technology that allowed it to be created so fast. But what is an mRNA vaccine and how is it different from other vaccines? mRNA vaccines are a new technology that was previously studied in flu, Zika, and rabies. Although new, mRNA vaccines have been studied for many decades. They have been investigated since they can easily be developed in a laboratory. This allows vaccines to be developed at a more faster and efficient rate. mRNA vaccines cannot give patients COVID-19. This is because the vaccines do not contain any live viruses in the vaccine. This vaccine does not interact with our DNA as well. The CDC reports that mRNA gives cells instructions to make spike proteins. Once the cells display the piece of protein, the immune system recognizes the protein and builds an immune response to it. Once fully vaccinated, if a patient catches COVID-19, the vaccine significantly lowers the risk of development into a serious infection. So now what? We have learned that 2 out of the 3 vaccines are made by mRNA. So how do you know which ones to choose? All 3 vaccines currently available, Moderna, Pfizer and BioNTech, and Johnson & Johnson, are all approved by the FDA and they should all be taken any chance given. The purpose is to inform you the difference between the three different vaccines. The Pfizer vaccine. The Mayo Clinic reports that the Pfizer-BioNTech vaccine is an mRNA vaccine that is 95% effective in preventing COVID-19 with symptoms. It has been proven that it's 89% effective in preventing disease in people with underlying conditions. This vaccine requires 2 doses, each 21 days apart. The FDA-approved vaccine for individuals 16 years and over. Symptoms post-injection include injection site pain, fatigue, muscle pain, and chills. These symptoms are seen more after the second dose, especially in young adults. Moderna, which is also available, like the Pfizer vaccine, is an mRNA vaccine. It has a 94% efficacy rate in preventing COVID-19 with symptoms and a 90% efficacy rate in preventing symptomatic disease in people with underlying conditions. The Mayo Clinic reports that the Moderna vaccine requires 2 doses 28 days apart. The vaccine is approved for people over the age of 18 years and older. Common symptoms after injection are similar to the Pfizer, but also include vomiting. Symptoms are seen following the second dose more and in young adults. Johnson & Johnson is known as a vector vaccine. A vector vaccine is a modified virus used to deliver instructions in the form of genetic material to the cell. This vaccine was proven to be 66% effective in preventing COVID-19 with symptoms, with an 85% efficacy rate in preventing severe illness from COVID-19. Unlike both Pfizer and Moderna, which require 2 doses, Johnson & Johnson only requires 1. The Mayo Clinic reports that the vaccine is safe for people over the age of 18. Side effects of the vaccine include injection site pain, headache, fatigue, muscle pain, chills, fever, and nausea. All side effects of both Pfizer and Moderna. In conclusion, vaccinating as many people as we can is important to try to regain control of this virus. By doing so, we can reach herd immunity, which will help us get back to normal. COVID-19 is a respiratory virus that originated in Wuhan, China. 2 of the 3 vaccines currently available are using the mRNA method. The 3 vaccines available are all approved by the FDA, and 2 are mRNA created vaccines, and the other is a vector vaccine. We've all had a rough 2020 and want to go back to normal. We all must do our part and trust science to get back and get